NbN2, the updated neuroscience-based nomenclature, is the result of an unprecedented collaboration of 5 major international scientific organizations with expertise in psychopharmacology and is recognized by leading scientific journals. NbN2 reflects contemporary knowledge. NbN2 is proposing to move from former terminology to new terminology. It is providing a pharmacologically driven naming system that helps clinicians to make informed choices. NbN2 decreases stigma by replacing the old disease-based nomenclature. Instead of giving antidepressants in anxiety, we talk about focusing on the serotonergic system to treat your anxiety, laying the rationale for selecting the specific drug and therefore enhance patients' adherence. For clinicians and researchers, NbN2 app is a simple yet powerful tool. How does it work? Start your search by typing in the blue area. For example, type depression in order to find which drugs are useful in depression. Once you enter your keyword, you will see all the relevant medications. In order to find out which of those drugs work via the noradrenergic system, simply add the search axis pharmacology and type norepinephrine. All the drugs that are effective in depression and work via noradrenergic system are now listed. If your patient also complains about pain, you can explore this further by adding another axis, efficacy and side effects. Type pain, and options for medications that fit this profile will be presented. Let's tap on nortriptyline. Now you can see its NbN2 classification, that is, its pharmacology and mode of action, as well as access to important relevant data, such as approved indication, side effects, efficacy, practical notes, neurobiology, and even its molecular structure. Another cool feature is swipe for similar drugs. By swiping left, you can see other drugs which are identical in their pharmacology and mode of action. Comparing between similar drugs might help you with rational prescribing. Stay updated. Get the new NbN2 app. New knowledge, new nomenclature.
The current naming, the current nomenclature of our medication is confusing for the patient. Very often we prescribe antidepressant for anxiety or so-called second-generation antipsychotic to depressed patient who show no evidence of psychosis. Many times patients ask me, is my condition so bad that you are giving me antipsychotic? I guess it is horrifying to find that your depression is being treated with antipsychotic. And of course, it has an implication on adherence. The patient going back and the family, the patient trying to understand why their depression is being treated with antipsychotic. Does the term antipsychotic actually help us to make informed choices? We actually talk about first-generation antipsychotic and second-generation antipsychotic. Second generation, what does it mean? Does it actually help us to make informed choices? Are amisulpride and aripiprazole are really like things? Are they really belong to the same category? Let's look at nomenclature in other fields in medicine. Let's look at our colleagues who treat hypertension. Their nomenclature is based on mechanism. And they are talking about diuretics, beta receptor blocker, calcium antagonist, AC inhibitor, and so on. And basically, they use the nomenclature as a tool while they are trying to make the next pharmacological step. So let's say if they would like to augment the treatment, they utilize the nomenclature, and of course they use, if they would like to augment, they use medication with different type of mechanism. Our nomenclature, the indication-based nomenclature, is not helpful in this regard. And this is strange. We are keep updating our system in psychiatry. There is constantly updating in the diagnostic system, moving from DSM-4 to DSM-5, from ICD-10 to ICD-11, but our nomenclature of psychotropic remains somehow around DSM-2. 5 major international organizations joined forces 10 years ago in order to come up with new nomenclature. This includes the ECNP, the ACNP, the ASEAN College, the CINP, the International College, and IUFAR, the International Union of Basic and Clinical Pharmacology. All of these 5 organizations joined forces in order to come up with better, updated type of nomenclature. In the task force, you see 2 members of each organization. The mission. The mission was to try to come up with a nomenclature that helps the clinician to make informed choices when they are trying to figure out the next pharmacological step, and to decrease stigma and enhance adherence by naming system that lays out the rationale for selecting a specific psychotropic. Just to clear one point, all the expenses related to developing this were covered by ECNP. There was no direct or indirect support from any pharmaceutical company. The core element is composed of 2 dimensions. One is pharmacology, and the other is mode of action. Let's focus about pharmacology. While we are prescribing our medication, how many pharmacological domains are we touching upon? If we're talking about a pharmacological domain, we actually, at this point of time, tapping about this 10 pharmacological domain. Each time that we are prescribing any psychotropic, we tap upon one of these 10. Right? So now we are moving to the second part of the nomenclature, of the neuroscience-based nomenclature, the pharmacologically driven nomenclature, and we focus on mode of action. And I'm going to pose again the question, how many mode of action we got in psychotropics? We got at this point 9. So basically, if you think about it, the medication that we are using nowadays, all the medications that we are using nowadays are composed of, combination between these 210 pharmacological domain and this 29 mode of action. So based on this, we came up with some product. The product is a book, which is NbN, and we got also NbN child and adolescent version. The NbN, the neuroscience-based nomenclature, expand our vocabulary. We are moving from this limited vocabulary of antidepressant, antipsychotic, anxiolytic, hypnotics, mood stabilizer, stimulant, and we can help us, encourage us, allow us to use different words, more concept when thinking and prescribing and describing the treatment. So if you think about it, how many different tools we got now in psychiatry? So we basically got 60 different groups of drugs to refer to. Think about it, each time that we are prescribing medication, we have 60 different groups of drugs based on different pharmacology and mode of action to choose from. Using naming system NbN that clarifies the rationale for choosing certain medication, because it provides us 60 different tools, it helps the field to move towards precise medicine. Where we stand now, let's look at the number of users worldwide, and we're talking about both NbN and NbN-CA. There is steady growth in the number. While we started in 16, it's moving on, and you see that it's going up. What about journal and books that recommend to use it? So if we look at the journal, more than 20 leading journals, much more than 20 leading journals recommend to use it, including, you see, American Journal, Biological Psychiatry, British Journal, and so on. All of these journals recommend or to use this while you're writing a paper. What about books? So it is part of the Oxford textbook, it's part of the prescribing guide. Steve Stahl is part of the task force. It's going to be in Maudsley prescribing guideline in psychiatry, the next edition. So it is there, and more organizations accept and recommend to use NbN. It is also part of some of educational activity like the NNCI, the American National Neuroscience Curriculum Initiative. It's part of the new curriculum of the British College of Psychiatry, the Royal College of Psychiatry. There is collaboration with the RDoc. It's part of the guideline of BAP for bipolar. And just recently, we got an endorsement for the APA. This was a couple of months ago, and the APA have an official acknowledgement, and they put a position statement on NbN. They also point out some positive features regarding this, and going back to what we mentioned earlier, the potential of improving patient acceptance of medication recommendation, i.e. a resolution of the why I'm getting antidepressant if I'm not depressed problem, harmonization of psychiatry with other specialty, reference to specific mechanism of action, avoidance of some of non-scientific terminology such as major and minor tranquilizer or second generation antipsychotic. We talk about all of this. And I think this is very important point, providing an important teaching tool that presents the depth and richness of neuroscience fabric of psychotropic. And we think that this, while you're teaching students, it could be a very important tool. And then what we mentioned earlier, expanding the psychiatric toolbox, referring to the 60 different type of pharmacological tools that are uncovered. So basically how everybody can join in, and the way to join in is to download the app. It is free of charge. You can get it either on Google Play or iTunes apps, and you can download it by typing NbN2. And I encourage you to do it now. What is included in the app? In the app, we got the nomenclature, the pharmacology and mode of action. And in order to make it useful, we include also 4 additional dimensions, which are the approved indication, the efficacy and side effect, the practical notes, and the neurobiology. What is included in approved indication? It's basically list based on the recommendation of major regulatory bodies like the FDA, the EMA, etc. So basically telling us where it is approved. Second part of the app, second dimension of the app is efficacy and side effect. Let's focus on efficacy. Efficacy aimed to highlight the situation where the compound fell short of approval for formal indication, although there is evidence to support its use, what we call off-label. And it's very important since many times the indication is not reflecting the scientific knowledge, and the indication, as you know, is many times related to some of the commercial interest of the pharmaceutical company rather than to the scientific basis. Regarding the side effect, we only include prevalent, life-threatening side effect, only this, so not all the side effects. The practical note is very important part of the app. It summarizes the clinical knowledge, including the dosing recommendation that has been provided by filtering through the task force opinion sievage. And the neurobiology, which is other part, is described basically empirical data and divided into preclinical and clinical section, which emphasis on the later, on the clinical section. We start by pushing on NbN2, and then you see that you get all this line there. You get name, you get type your search, name, pharmacology, mode of action, approved indication, efficacy and side effect, former terminology, and so on. Let's say we'd like to focus on medication that work for OCD. So we push on approved indication, and then we type OCD. So now we are getting all the medication that work on OCD. Let's say we touch on one of them as citalopram, and then you get the pharmacology, mode of action, indication, and since we are focusing on OCD, you see that it's in different color, and then you see the efficacy, you see some of the side effect, and then you see in the practical note referring to QT interval prolongation. And then in the practical note, you see also the recommendation, the dose recommendation. There is also a layer about pregnancy, and if you touch upon the neurobiology, you get the neurobiology of the medication, moving on from preclinical to clinical. As was mentioned, you see that there is this sweep to the left. You can look for similar medication in this regard, and then you can choose from the similar medication which medication you would like to choose. So this is very basic way to look at this. At least you know what is recommended. If we would like to see the same in children, we are moving now to child and adolescent, and again we are pushing on approved indication there. And we see for children what are the approved medication for OCD, and you see all these medication are approved for children. So you can know what is approved and what is not approved, and again you push on this medication. Let's say you push on fluoxetine, and then you do the sweep to the left, and you see other medication that have the same pharmacology. Some of them approved, some of them don't approve, but the approval is, as I mentioned, is not necessarily related to our knowledge about this. It's related to the interest of the pharmaceutical company. So you can choose among the medication that fits the case the best. So this is one thing, and we can now move back to NbN2, and then we can do other search. Let's say we'd like to see what medication are approved for PTSD. So again, you push on approve in indication, and then you type PTSD, and then you see the medication that are approved for PTSD. Again, it doesn't include all the serotonergic medication, because only some of the pharmaceutical companies, only some of the medication were did studies in PTSD, but not all the medication, but at least you know which medication are approved or not approved. So this is, and so you can play with this. This is very basic way how to use NbN. So let's say we got a patient with depression that doesn't want to take serotonergic medication anymore because of the sexual side effect, and would like to get better sleep. This is the patient that we are seeing. Which medication would you prescribe for this patient? Depressed patient, don't tolerate sexual side effect, and would like to get better sleep. So you can use the search engine and find out what is the best medication for this patient. Let's do it together. So we're talking about depression. Why it is not? The depression, so I type here on blue, depression. So basically now I get all the list of medication that work for depression. But as I mentioned, the patients suffer from sexual side effects due to the serotonergic medication. So what we'd like now to do is to see if we can give him noradrenergic medication. So what we are doing, we are pushing on add search axis. So we push there, and then we push on pharmacology, and we push on norepinephrine. So now what we are getting is medication that work for depression via noradrenergic system. But as you remember, the patient also complained about sleep. So we are going back on add search axis, and then we are pushing on efficacy and side effect, typing promote sleep. So now we are zeroing down on medication that work for depression via noradrenergic system and promote sleep. But as you remember, the issue that one of the issues that the patient come was about sexual dysfunction. So we'd like to choose medication for depression that is not interfering or have minimum effect on sexual dysfunction. So what we are doing again, we push on search axis and type again and push on efficacy and side effect and type sexual dysfunction. You see sexual dysfunction low. So now we are zero down on 3 medications for the patient that we are seeing in the office that help us to zero down on medication for depression that promotes sleep and has very low sexual dysfunction. Let's say that we would like to look at one of these medications, mirtazapine, so we push and then we go back to the basic issue of NbN, the pharmacological domain, the mode of action. You see the indication. You see that in the efficacy, it's promote sleep. And if you look at the practical note, you see low level of sexual dysfunction. And then while we switch to the left, we see other medication with similar type of pharmacology and mode of action. And then you can, of course, choose other medication. Let me give you another example how to use it. And in this regard, we are going to move, let's say, to the child. So we are moving now to children. Let's say that we are seeing a children now. And the children come and complain, and the main complaint is ADHD. So what we do, we type ADHD. So we basically get the medication that related to ADHD. Another complaint of the parents is aggressive behavior. So we again touch upon add search axis on efficacy and side effect, and we type aggressive behavior. So you get medication that work for ADHD and aggressive behavior. This individual child also have autistic spectrum, so we'd like to get medication that work for ADHD with aggressive behavior, and in the autistic spectrum, again, pushing on add search axis, typing autistic spectrum, and we get these 2 medications. But as we are looking at this child, we realize that there are tics also. So we'd like to, again, to personalize the medication and make sure that we can deal with the tics too. So again, we are going back to add search axis, push on efficacy and side effect, and types tics. So now we zero down on medication that work for children with ADHD, aggressive behavior, autistic spectrum. We stick, we touch on this medication, and we see all of this issue there. Again, in the practical note, we see that there is some recommendation, some point about how to use the medication, and there are some recommendations regarding the dose. Just before I finish, let me give you another example. We are switching back to NbN and adult. And let's say we are looking at one of the medications that we many times use in case of panic. And let's say that we'd like to look at one of the benzodiazepam. And then we look at this. And then in the practical note, we got something that I think help us to understand better in the practical note. It's written many different benzodiazepine receptor agonists are licensed worldwide, some in most countries, some only one or two. They all act in the same way and designed only, and designated only by pharmacokinetic and so on. So basically give us very important clues regarding pharmacokinetics properties. Let me point out to you what is one of the most important part of this. You push there, and then you get, what I was talking, the 10 pharmacological domain and 9 mode of action. But what is very important for us is this part, send feedback. We know that we don't have the perfect product, and we'd like to get feedback from all of you in order to improve it and to make it more useful. Thank you for your attention.